I'm technologist by nature, so I really love development of technologies, but then you need to think about the fact that the technologies are being used by very non-technological people. So how to pack them in such way that it becomes very intuitive and seamless for them. Hello, I'm Dorian Averbuch. I'm a serial entrepreneur. I have 3 successful companies behind, 2 exits. The key achievement I'm proud of is the fact that I was able, by my work, to change the pathway for lung cancer patients. 5-year survival rate used to be just 10% worldwide at 15% in US. This was the reason why I started Body Vision Medical and developed new technologies that made this available. Body Vision achieved high diagnostic yield, not just in US, but worldwide. And now this technology became actually standard of care. And right now I'm working on a new exciting company that is poised to change the pathway of back pain patients in US and worldwide. I see that low back pain is a significant problem. There are 70 million people in US alone that suffer from back pain. 26 million suffer from acute back pain, but only 1 million is getting a permanent solution for their pain, creating a $50 billion market in US. We are losing 80 million work days collectively. If we can get this time back, this would be a very impactful solution for people. I see this as a next challenge for myself. My goal is to allow moving these procedures from hospitals to ambulatory centers where they can be performed more efficiently, safer for the patients, and also it becomes win-win for payers, doctors, and patients themselves. When I was a software developer and spent a lot of time programming and coding, I suddenly felt pain. Later I had to wear wrist braces for both hands. I had to get consultation from the ergonomic advisor, and I found that chair, the pose, the table, the height of the hands, everything is really important. When people are very young, they are less sensitive to that. When you are getting older, you become much more sensitive, and it's exponential. I'm very experienced with choosing chairs, since when you are typing, you need to have a really good support for your hands. There's also the need to go backward with the chair and still get a good support from the back. The ability to go up and down, ability to use this, and ability to have really good support for your back when you're laying backward are the key features that you need in the chair. I would approach this from the end. What problem we are solving and what is the solution? I would imagine how this would work at the end and what kind of problem it will solve. The second is who is going to use it and how in order to solve the problem. So we are talking about healthcare. My experience is delivering solutions to doctors. I would have first conversation with the doctor about the opportunity, if this makes them excited or not. The next step would be to create very early prototype in order to explain how this is going to work. Doctors' imagination will work very differently from engineers because they have a practical experience. So when I'm showing them the prototype of the product, they would ask right questions, and as a result of these questions, I would be able to understand whether my solution is viable. And if it is, what is the minimum feature set that will make them excited and actually wishing to use this product? The most important thing for me is to make my customer happy. If I feel that the customer is happy and appreciative to the work that me and my team is doing, and I remember one of the shows when 2 big customers came in and physically kissed. For me, this was one of the highest moments I could experience. There are several things that make me feel motivated. Number one, by my work, I'm creating products that save people's life, change their destiny. The other thing is that I'm technologist by nature, so I really love development of technologies, but then you need to think about the fact that the technologies are being used by very non-technological people, like doctor and medical staff. So how to pack them in such way that it becomes very intuitive and seamless for them. And number three is my personal desire when I was a kid to be a doctor. Allows me to be as close to doctors as possible, and this makes me feel really great.